Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you about activating the deep neck flexor muscles in a sitting position. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So essentially, I've done other videos on activating, I just call them sort of the core muscles of your neck. And these are the deep muscles in through the neck that attach onto the individual vertebrae. And their job, right, is to actually flex the neck forward. And in a lot of cases, right, when people are experiencing neck pain, these muscles will be weak, and there'll be a tendency to overuse muscles in through the front, the very superficial muscles in through the front of the neck. And also in a lot of cases, when these deep neck flexor muscles are weak, I find that a lot of patients tend to fall into this forward head posture type position. So that's why I like to also teach this exercise in sitting, because especially for individuals that are sitting in front of the computer a lot, right, that are having to go 8 hours a day sitting in front of a screen, there can be a tendency to develop this forward head posture, and these muscles can become quite weak. And so the way that you activate this in sitting is essentially, number one, you want to actually place your tongue at the roof of your mouth, and you want to do what's referred to as diaphragmatic breathing. So diaphragmatic breathing essentially is when we breathe in and have the stomach protrude outwards, activating our diaphragm. The reason we want to do this is to minimize, right, the activation of the more superficial muscles in the front of the neck, so your scalenes, your SCM, and also your upper trap, and prevent chest breathing, right? And then from there, what you want to do is actually think about bringing the chin area to kind of the mid portion of the neck. So for me, like basically where my Adam's apple is, and then we want to hold that for a second or so. And again, while we're doing this, we're trying to minimize, right, activation of these really superficial muscles. So it looks kind of like that. And I also like to sometimes just palpate these muscles while I'm doing this action. So I'm going to do my diaphragmatic breathing. And while you do this, the other thing to keep in mind is you're actually putting the muscles on the base of your skull, your suboccipitals are called, on a bit of a stretch. And so these muscles tend to become shortened when we, again, go into this forward head posture, which can in some cases produce tension headache type symptoms. And so again, a really fantastic exercise to do throughout the day, particularly for people that sit for long periods of time, for people that have had chronic neck tension and tightness, and then kind of live a very sedentary type lifestyle. If you have any questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.